Welcome to Action on Pain, a podcast dedicated to highlighting the significant efforts underway in Canada to address chronic pain.
By presenting perspectives from individuals who live with pain, researchers, clinicians, and other stakeholders, we explore various impacts on people's lives and the initiatives, research endeavors, and the committed professionals working to effect meaningful change.
This work is guided by Health Canada's Action Plan for Pain. Join us as we raise awareness and share stories that are shaping the future of pain management in Canada.
Hello, everyone. Welcome to another Action on Pain podcast. I'm Virginia McIntyre, joining my two lovely co-hosts, and I'm here in Nova Scotia. Today, we are happy to welcome Dr. Patricia Poulin and Dr. Yaadwinder Shergil. They are the co-leads in the development of the Power Over Pain portal. We are really excited to learn more about this first in Canada chronic pain management portal. Personally, I look at this as a hub of resources and something that we share all the time with our members of the People in Pain Network.
Hey everyone, I'm Keith. I'm just always excited to be back in the studio with Jen and Virginia, and especially today's two guests. I am so looking forward to learning about this today. I'm aware of this resource, but I am just excited to hear about how it came about. So I'm looking forward to getting into this conversation shortly.
Likewise, so I'm going to keep my comments short. My name is Jennifer Daly-Sear. Keith, Virginia, as always, a pleasure. I'm joining from Ottawa. Over the moon excited that we were able to book some time with Drs. Shergill and Dr. Poulin. And I just want to add one little personal comment, and that is that little known fact, Dr. Poulin introduced me to the world of advocacy in the pain world, and I am forever grateful for that and happy to share that story at some other time. And also to say that every time I share the Power Over Pain portal, I always hear great feedback about it. So congratulations on that. So welcome to both of you today.
Thank you so much.
And it is such a remarkable portal that is in play. And the three of us are excited to hear about how this came to be. And we know that it connects to the Action Plan for Pain in Canada. But can you tell us about how this all evolved and how we are here today?
So we've known for a very long time that access to care is a problem, in Canada for people who live with pain. The work of Manon Chouanière, Stop Pain first study that dates back now to probably about 2010, really highlighted that. But it also came through in a large national priority setting partnership exercise that we did with people with lived experience really at the center, along with clinicians in identifying research priorities for chronic pain in Canada. And one of the top priority was, again, improving access to care. But it's really during the COVID pandemic that the window of opportunity to develop this online portal came about. There were, prior to that, some resources existing, like the coalition, the Canadian Pain Coalition had a website of resources, but there was no online self-management tool that combined self-assessment, a range of resources for pain, guided recommendations on where to start, depending on a person's goals, a person's needs. So that was not existent. But during the COVID pandemic, Wellness Together Canada was set up to address the mental health needs of Canadians during the COVID pandemic. We thought we need the same for pain. And then started to applying for some funding and finally got funding from Health Canada to support the development of the portal, along with some funding from the Ottawa Hospital Academic Medical Organization Innovation Fund, as well as support from the Chronic Pain Network, which you have hosted in the past with Dr. Buck.
Yeah. Yeah. And just to add to what Patricia said, even looking at that national priority setting project, we had 1,500 people contribute to that project in and of itself. And thinking of the number of suggestions that came through, I think we had over 5,000 suggestions that had called for better knowledge, better access, coordination, patient-centered care. So it's just to, I think, really pay some respect to the project itself, that it was done in such a way where so many people's voices were brought in and very clearly aligned with what the Action Plan for Pain in Canada was suggesting too. And just another note on that, Patricia, I was just thinking about our emergency department research work as well. which really highlighted
Mm.
a meaningful proportion of the emergency department visits were due to chronic pain.
Mhm.
And, really thinking about these patients not receiving the right care at the right time. And now they're trying to navigate this fragmented system and then coming to the emergency center where they're not receiving that longitudinal pain care adequately. So, yeah, just wanted to add those two little nuggets in there.
Can I add something in about that? And I hadn't met you yet, either of you yet at this point in time, but I was one of the people that I'd been told at the emergency room in the Ottawa hospital that if I end up coming there 8 times or more, I could participate in the study. I made it to 7 that one year within that period. But I do remember that. So when I met you, Patricia, it was like a connection for me. I thought, oh my gosh, there you were starting the study. And this happened to be at the seed of my, well, beginning with this uninvited guest.
Mhm.
I could add, and the impetus for this study was
Mhm.
that actually the study predates the investment that happened in Ontario in the creation of the Ontario Chronic Pain Network. And so at the time within our pain clinic, we had anesthesiologists, nurses, and a 0.3 full-time equivalent of a psychologist. And that's actually through research funding that we were able to develop this program for people who repeatedly came to the emergency department. And then eventually were able to apply for funding to have a whole interprofessional team as part of the Ontario Chronic Pain Network. Because it is through the doorway of research that we're able to first really start to develop our programs, including Power Over Pain. And then in the Ontario Chronic Pain Network, one thing that came about is that out of the 18 clinics, most clinics actually do very basic pain education and workshops on sleep and workshop on stress or mood and anxiety. And so another motivation for developing the portal was to really offer everyone in Canada who live with pain a better chance, more equitable chance of being able to access a range of resources and to improve health system efficiency. There's no reason for, 50 clinics across Canada to offer a pain neuroscience workshop.
Mhm.
If we can combine our
Mhm.
forces and once in a while each offer a pain neuroscience workshop through the portal and direct people to it, then it's not only the clients or the patients of our clinic
Mhm.
that benefit, but it's the whole population as well.
Brilliant. Just brilliant.
And
That's amazing.
And then we can reallocate the resources devoted to lower intensity care to the more complex one-on-one care that is still very much needed.
Sitting here and I just sort of digesting what you've said. And there's a couple of thoughts that I have. And one, and this is a little bit on the structural side, so forgive me if I get in the weeds, but the funding was made available, so you saw this opportunity. But you mentioned like over 1,800 people and 5,000 inputs. How do you take all that? How do you collate that? Like, I don't imagine you're sitting there in your office at midnight, one person with a pen and a piece of paper going, well, let's just put a bunch of columns together. Like, how do you take all of that amazing information and develop into this output, which is this amazing tool? Like,
And then
Actually,
to add, how do you get all those people? Like, where did you
yeah,
find
yeah,
that
yeah.
to add to that?
Wow, that's amazing.
Great question.
Yeah, I was really reflecting on this, but we had amazing partners that also had distributed the link to the survey. And this was now, I think, dating back 2015, 2016 when we did this work. I know it was published in 2018 though. But, at that time we didn't have AI or anything. So we're painstakingly taking all
Oh,
the comments, putting it into Excel, and then multiple, like our group, I think we had maybe 2 to 4 individuals going through all of the different comments and putting them into their individual themes. We met, I can't even tell you how many times we must have met as a group to pare down how many comments we were getting per theme. So thinking about like better access to
mhm,
care or quicker access to care. And then from categorizing all the comments, you're starting to see the themes pop up.
mhm,
And then we even went a few steps further and did a couple of surveys with clinicians, researchers, people with lived pain to really narrow down this list of themes as well. And that's how we ended up having, 14 top research priorities that
mhm,
were outlined in the paper, 10 to 14, don't quote me on that. But
mhm.
Patricia, do you want to add anything to the
Sure.
process?
So the 10 priorities, actually, now you were referring to the pediatric exercise that followed our exercise that was for adult and pediatric. And for us in our project, we identified 14 priorities. And as Yaad mentioned, it was successive rounds of getting feedback from people with lived experience and clinicians mostly in terms of identifying those priorities.
What a phenomenal
That's-
process. And
Yeah. And
kudos to you.
sorry, I was just going to say there's a terrible joke here. I mean, it painstakingly work for this work to do that thematic coding. But
Well put, Keith.
and now how long did it take to go from sort of the genesis as idea to like turning on the switch and saying, here it is live?
Well, generating the idea was very quick. As soon as Wellness Together Canada was up and running, within 24 hours, we had an email to the leads of Wellness Together Canada to say, we need to do something for pain. Even like, could we integrate pain within Wellness Together Canada? And Indiana actually, very glad that we took the separate kind of pathway, because people living with pain often were subsumed under mental health and substance use health. There's a lot of connections, but it's important to have a doorway that's really for pain. So the idea, and the start of the work happened very quickly, but it was really in, my goodness, what month was that? That was it March 2022 that we received the funding from Health Canada. We had received a little bit of funding also before then to start really working on it. And then we were live with the first iteration of the portal, I believe in July. And then we continued to iterate. So
you started, you got your funding in March of 2022, and your first iteration was launched in July of that year?
No, it was December. It was our revamp.
Okay, but
It was the revamp.
still.
Yeah, I mean,
Wow.
we had a functioning portal, I believe. I think we went live December, like right before the holidays, because we knew holidays can be a really distressful time for individuals living with pain. And so our goal was really to launch the portal before the holidays. And I know we reached that goal. And then we went through a series of iterations. The portal has evolved as it's meant to evolve, right? These are like learning health systems where we're learning what works, what doesn't work. Amazing partners have come on, and amazing individuals that have used the portal that have come up with comments and said, hey, like, fix this, or can you include this, or can you improve on here? And we've gone through multiple iterations. So we had a second iteration, a huge, massive uplift to the portal that was done in July of 2023.
We're talking lightning speed change here, lightning speed implementation. Just want to make that comment.
Which makes it to lightning speed access for people. It's been years ago, and I can't even remember, you reached out to us where I lead a peer support group to be, provide that on the portal so people have access. But for me, it's like, okay, now on our website for resources, we have the portal. People go to the portal. You come in usually once a year, speak to our groups. Here's how to navigate the portal. But it makes my life easier because everything is there. The workshops are there. Everything is there in one hub, whether it's youth or adults or resources or workshops. And, you can sign up individually, or you can just stay on the portal, whatever you want. Choices, it belongs to the person, which is amazing.
Yeah, and vice versa. Like you mentioned about Virginia, the portal becoming a resource, but your peer support group, the People in Pain Network, and it is an important resource onto the portal. So what I want to also do is like tip my hat to all the partners who said, yes, sign me up to have a card on the portal for people to find us if they need. All of the intervention developers, like on the portal, we have several courses. We have the pain course that was developed from Macquarie University that has more than 11 publications on its effectiveness, its cost effectiveness. We have empowered management that was developed at TAPME. We have an ACT-based, acceptance and commitment therapy-based course that was developed by a team in Manitoba, and an ACT course developed by a team in Quebec. We have Live Plan B.
And Patricia, these are all free, correct?
All free. And they were courses that were sitting nice, because the team developed it, the pilot testing, the study, but then it kind of was just there. And then we were able to bring this all into the portal. And again, one of our motto is that everything has to be free to the portal. There is no cost.
Fabulous.
Unbelievable. So
I
what
have
I
a
what I
personal,
love.
sorry, Keith.
No, go ahead, Jen.
I have a
Yeah.
personal example to share. Won't mention names, but a cousin of mine was really debilitated with pain. Had kind of reached the end of the road in terms of resourcing, didn't know where to go. And I said, "Have you heard about the Power of Pain, a portal?" And then fast forward a few months, he found ways through that portal and the resources available to access the care that he actually needed. And he has come so far since that as
Amazing.
a result of that routing that he took. So I offer that as a really powerful example. He's very appreciative.
That's amazing. Mhm.
Yeah, that's really, really nice to hear. And just even the portal's built on a stepped care model. So Patricia, I was thinking about even the project or the study that we did at the Ottawa Hospital Pain Clinic, or I should say the project at that time, where we looked at essentially the stepped care model to address like the growing wait times for the interprofessional pain program. And Patricia, actually, you speak about this more. I just brought it in.
No problem. Yeah, absolutely. There's a really direct link between the Power Over Pain portal and the step care model. The step care model, there's different ways to deliver step care, but it's the idea that there's different intensities of intervention that patients or people living with pain can access, from basic education to more intensive education, to interactive workshops, peer support, individual assessment and treatments, as well as therapy groups, and then more specialized care, case management, and systems navigation. So that's like, I've just drawn up, kind of a full spectrum of the step care continuum. And clinics can implement a step care approach in different ways. But it's the idea from Step Care 2.0 model that we're using, that we can actually create a treatment plan that leverages different interventions on that step care continuum. And so before the existence of the portal, basically the entire spectrum or continuum was delivered within our clinic by our individual provider. But now with the portal, the first 4 to 5 steps, education, self-management resources, peer support, interactive workshops, that's all covered through the portal. So any clinic now or any provider could build their own step care continuum with their favorite resources on the portal and address the biopsychosocial factors that contribute to pain. So in our clinic, before we implemented a step care approach, we had 2 to 5 years to even more years of wait times to access a consultation with a clinician, with one of our physicians. And then when we pivoted to the step care framework, we were able actually to see all patients referred now within a 2-month time frame to at least get them started.
It's incredible.
Wow.
Outstanding.
Wow. Yeah. I love the fact that you've brought in this step care model. It's critically important. These resources, and I've heard from others, and we're hearing more, and you've done it, that these kind of resources, and it should not be adjunct to care. People shouldn't be put on a waiting list and 18 months later for some sort of intervention. This is part of their treatment. And we hear stories from people that while they're waiting for a medical intervention, and I'm not anti-intervention at all. I have a spinal cord stimulator. But we hear stories of people who are waiting for an intervention. When they go through these kind of programs, they find that maybe they don't need that intervention because they found a way to manage their life without it. So that's step care is so important, and to do it the way you've talked about it, it takes people through that journey, and they're like, hey, I'm able to live and manage my life now. So, and the access outside of the urban areas, this is incredible. Most of Canada lives not in an urban center. Well, actually, the minor population, but there's so many people who live outside these urban areas. So this is a free access. They don't have to come into the big city for it.
Absolutely. Yeah. Thinking of the individuals that live 3-4 hours away from their tertiary care center or wherever
Mhm.
they're supposed to be getting care from. Just thinking of how the portal really uses that step care framework to provide early access to education and self-management resources, particularly when the patient's waiting these,
Right.
10 to 18-month wait times. There's something for the patient to be doing that can be helpful in many cases.
Exactly. I'm just thinking about in my day, 11 years ago, when I was being referred to the pain clinic, it did take a year and a half, and that was considered quick.
Mhm.
And in the meantime, though, my person was saying, well, I'm waiting for that appointment so I can get what I need. There wasn't, so
Mhm.
blessings to both of you and the
Yeah.
team for
Mhm.
bringing this forward, because that just will transform that period of any kind of wait time period. Thank you. Sorry, Virginia.
So how do we get that out there to the clinicians to know the
Mhm.
power of pain? Like I know how we get it out to people on the ground, people living with pain within our network.
Mhm.
But how are we getting out clinicians that they can
Mhm.
say, hey, you have this, you're waiting to see somebody? Like, what are we doing for that?
I mean, they utilize multiple strategies. I mean, first, direct to the public. We had a huge social media campaign, and we reached like more than 3.5 million people that at least, that were aware of the portal's existence through the messages that we crafted. Currently, we actually have already reached 300,000 visitors to the portal and more than 70,000 repeat visits. So, every time somebody comes back, it means that the first time around, they found something that was, intriguing enough or helpful enough that they decided to come back. So to clinicians, we've also developed a Power for Pain implementation champion group. So it's also a community that comes together on a quarterly basis, and we have people from programs from across the province, along with people with lived experience and help and decision makers. And we need everybody's help to to find. And we're working with implementation scientists, with communication, with people who have communication background, and we're also now studying how do we integrate the portal within primary care. So there's a study going on now that's being led by Rosemary Wilson at Queen's University. And maybe the last piece too that I want to maybe add to that is also to remind all clinicians that behind this portal, it's not just Dr. Shergill and myself, but we have a fantastic group of people with lived experience who have co-built and vet everything that goes onto the portal. We've had a scientific
Mhm.
advisory committee throughout the entire Health Canada grant tenure that we had, that met on a regular basis. And all of the research that's gone into the development of the different resources that are onto the portal. So there's that kind of credibility to it too.
And the portal really isn't meant to like replace clinicians, right? It's to provide patients and people living with pain resources while they're waiting and to even augment the clinician's practice. So, as a practicing clinician who focuses a lot on movement, when I'm sending my patient home with movement strategies, sometimes I'm like, well, here's a YouTube video, or you're saying to the patient, move more. But what does that mean?
Mhm.
And so
Mhm.
then using the portal and integrating some of the resources that are available on the portal is a way to just take that onus off the patient to find the resources and to figure it out themselves. And you're providing them with a trusted resource. It's evidence informed. It's been vetted by our lived experience advisory committee, which is massive to this portal, to have people
Mhm.
that live with pain that have vetted the resources and said, yes, like we should be putting this on the portal. So I think it's really important to just keep that framework in mind that the portal is really not meant to replace. It's a supportive tool to get people resources early and to augment care where possible.
Mm-hmm. Mm-hmm.
That is amazing. And I think that is a great way to wrap up our time today, because unfortunately we've come to the end of our conversation. So, Dr. Poulin, Dr. Shergill, thank you very much for this. It was amazing to learn about this, to learn how quickly you pulled this together, the input that you've had. You've developed a free resource that is, I love, bi-directional. You talked about there's information going out and people can put information back in on it. It accesses, it's easy access to people in the rural communities. And it is clearly something that is not adjunct to people's care. It is foundational to their care. And your conversation about how it works in the step care model, I think, is just underscores the importance of this. So huge congratulations for you and your team. I know you're very clear on there was a huge team behind this. And we thank you for your time and just for sharing everything that you learned as you developed this and sharing that with us.
Yeah, it's fantastic information. Congrats to you and the team for sure. And we're happy to play even a small role in helping inform people about this phenomenal portal. And we'd also like to thank all of you for tuning in to Action on Pain podcast. We hope this episode has shed some light on the important work being done in Canada, as guided by Health Canada's An Action Plan for Pain in Canada. Until next time.
Thank you for joining us today on Action on Pain. If you enjoyed the discussion, please follow us on your preferred podcast platform to stay updated, and please share with your networks. A 5-star rating and review would help others find our show. Your feedback is important.
This podcast does not contain any medical advice. Please consult with your doctor if you have any questions or concerns.
The Action on Pain podcast is made possible by the generous support of the Chronic Pain Network, a national research and knowledge mobilization network.
The views, opinions, and content shared by hosts and guests are their own and do not necessarily reflect those of the Chronic Pain Network or its funders.